another edition of TCM Graduate TV. This is episode 67, and that's right, we finished up the big bad heavy hitter review on episode 66, which was for the entire small intestine channel. And we're moving right along, so do the diurnal flow of chi with me. So we did lung, large intestine, stomach, spleen, heart, small intestine. We're on to the urinary bladder, UB for short. So UB2 is definitely a heavy hitter in my clinic, and I'm going to tell you why. But before I do, I just want to wax some poetic on UB1. Now, UB1 is known to many people as a danger point, and as I have told you many times before, I abhor the idea of having acupuncture points that are called danger points. All acupuncture points are dangerous if done incorrectly by a mal-trained practitioner. So UB1, very, very good acupuncture point for any eye concern. I do prefer stomach 1 to UB1. However, if you are comfortable using UB1, you definitely can in the clinic. If you're not comfortable using it, find somebody who's comfortable teaching it to you. So any eye concern could be an eye infection, could be maybe some lack of lacrimation or dryness, could be night blindness, could be vision blurriness in general. There's lots of options for UB1. But before I do UB1 and before I use stomach 1, I'll definitely use acupuncture points that are neighboring. So a good example of this is what is on my heavy hitter list for today is UB2. So of course, UB2, any eye concerns. The way I like to needle it is I like to needle it downwards towards UB1. I like to take a 1-inch needle, and about a quarter to a half of that needle will go underneath the skin from UB2, directed down carefully towards UB1, and that helps me treat UB2 and kind of UB1 at the same time. It's a great alternative to just jumping in right to UB1. Plus, patients are very uncomfortable when we tell them that we're going to stick a needle between their eye and their infraorbital ridge, for example, in stomach 1. So any eye concerns, of course, Bell's palsy is another great reason to use UB2. And of course, any problems with sinuses, maybe sinuses being plugged, nasal discharge, that sort of thing. One of the old Chinese texts, I believe it's just called Chinese Acupuncture and Moxibustion. It's a brown book, and they mention extra head neck 3 yin tong, not for being used at all for calming the shen. That is definitely in Deadman, but in this book, they don't mention calming the shen for extra head neck 3 yin tong. What they mention for it is any problems with the nose, so 1 above and 2 below. So of course, a neighboring acupuncture point is UB2, and it's excellent for any nose problems. So there you have it. If you're comfortable using UB1, do it. If you're not, train it. Just want to remind you that safety is king, bedside manner is king, and results are king in that order. Thanks for watching this video, and I'll see you in the next one.